Hello, listeners. This is Yukta speaking, your host for today's episode, which is the talk given by Dr. Sneha Vaidya. This talk is a part of the first virtual IC nursing meeting hosted on the topic Nursing Practice Trends and Innovation. Let us hear from Dr. Sneha Vaidya.
Namaste and good afternoon to everybody. So I have just very few slides on how I would take this entire journey. Uh, it reminded me when I was just going through, what should I really talk to this young generation who is going to prepare themselves into this community of nursing, whether they will be at the bedside or whether they would like to be teacher, whether they would like to be at the community. It's all mixed kind of an emotions that is running currently at the mind of a single nurse. So I thought, let me take them to certain things of how one could guide themselves to be to achieve what they have to be. So I remembered a saying by one of the Director General Tedros of WHO, who had quoted that the pandemic has reminded all of us how much we all depended on nurse from our first days to our last, and why all countries must invest in nurse new and for the future. It's a very profound statement if you see, because we all had witnessed that all of a sudden during pandemic it was the nursing fraternity who was in the front, who was battling along with the patients to get them out of it and even putting themselves into this risk. So I always feel that as a nurse, how important we are to the community, how important we are to the entire world, and what is the importance of, oh, yes, we must have learned a diploma in nursing, or we must have learned a graduation in our nursing, but in the end it all led to a single path, that is nothing but patient care. So I'll take you through few slides that will remind us that what it means to be uh, a nurse. What will your role be as a nurse? I mean, what does it look like to be as a nurse? I always feel that if you take this profession, okay, you entered as a student, but now you're going into a world where there is a lot of complex things, there is a lot of complex situations around you, a lot of complex situations in healthcare. So the first thing that you need to know, or you need to have as a nurse, is you need to be sensitive and sensible. What it means to be sensitive, sensitive is nothing but to be compassionate. If you do not carry that particular quality in you, it's so inborn in a nurse. Not everybody can be as compassionate. You cannot be able to deliver that particular kind of care that's required. And when you're sensitive, you have to be sensible, because when you're compassionate, you know that you're giving the right care to the patient. Now, as a nurse, when you be sensitive and sensible, you know that when you have to plan your patient care, you know how you need to implement that care. And once you have implemented means once you have given that care, you know you need to evaluate the impact of the care that is given to the patient, because every care that a single nurse will give to the patient will lead to the recovery of the patient. In workforce, during the work schedules, a nurse should be able to make sound clinical judgments. There is a situation where your patients are sick. There is a situation where your patients will give you an alarming trigger. And that is the time when a nurse has to be really, really judgmental in order to take that correct decision, to make a call to the clinician or make a call to say that my patient is in trouble and I need help. The nurse has to find that the work is meaningful and fulfilling. She should feel satisfied. Being at the bedside is not just having a one lunch and a two punch kind of a situation. She has to feel that, I am over there to bring a difference in the life of a patient. Every time as a nurse, whether you work as a new registered nurse to the N number of experience, definitely it is a requirement that you need to upgrade your clinical equipment. Keep reading. There are so many new things that are coming into the market. So you need to read and you need to be over there so that you are able to take care of your patient with the latest technology or with the latest programs that are available over there. Participate in educational programs. It's very important. It's very important because there's a lot of learning, there's a lot of knowledge sharing that happens in educational programs. Determine your future path. As a new registered nurse, when you're out into the world of the healthcare, there are many possibilities of what you want to become. Be sure, keep your path very clear with you of what you want to become in life, and find your place in healthcare. Whether you want to be in education, whether you want to be in the clinical service, whether you want to be in the technological services, like where artificial intelligence is taking up its roadmap along with the digital media, whether you would want to be part of it, you have to find your place in the healthcare so that you can pose out as a better challenge into the healthcare industry. Now, what is the need for innovation in nursing? We are just speaking, I mean, many speakers will have a lot to speak on this, but I have few things what I felt that I should talk to you all is, you have to maintain a quality in the healthcare services. If you are a nurse, you need to know that every patient who walks into the hospital requires quality care. You cannot be doing a care just for the sake of doing it. Be competitive in technology. Now, technology is taking over. There are so many technologies that have come into the market. I can just share a few because I think so. I have another speaker who's going to talk more about artificial intelligence. If I have to give an example of robotic surgeries being very much as a part in the operation theater. So a nurse knows how to be at the console, and the nurse know how also to be at the at the bedside and handle along with the surgeons the robotics. If I have to talk about technology, I talk about interfacing about the vital signs that are there that are entering into the digital media, and many more to talk about that. Increasing advances in healthcare field, different innovations, different kind of materials that are entering in case of invasive procedures, in case of other procedures that are there are getting competitive in origin. Emerging clinical and nursing specialties. Today, a nurse doesn't recognize only as a nurse. She can widen her horizons and become, I've just quoted few examples, become a wound management nurse, become a pain management nurse, become a chemo nurse, a nurse practitioner, which is just emerging in India, or even become a nurse informatics specialist. Why I'm talking about nurse informatics specialist is where a concept of EICU is taking place. It is taking place everywhere. So an ICU nurse can participate of where she can give her information of identifying the triggers of just looking at the screen and providing that information to another nurse who is there at a community level. So this is how you can have different kind of innovatives that are there in the nursing, and she can look forward. I will conclude that a nurse who is there, she should know how to think. If she can think, she should know how to access. She should be able to know what is the latest thing in the healthcare field. If she knows how to access, she should know how to interpret, how to read, how to define, how to conclude, and how to use the knowledge that she has in her. And that can define how to be the leaders and how to defend their ideas. My dear team members, my dear nurses, all that I will tell you is the knowledge in healthcare is like an ocean. It's like an ocean. You may find many sharks, you may find, many things. You have to be a shark in that ocean. Not to go and attack anybody, but to be competitive in yourself, to be competitive in your own ways, so that you know how to take forward this particular journey as a nurse. And that's the message that I will leave for everybody. Yeah, thank you so much.
Thank you, Dr. Sneha Vaidya. To watch the complete club meeting on this topic, visit the link in the description below. Subscribe to the channel to get instant access to all the podcasts. Follow us on social media through the links available in the description below. Thank you all for spending your time in listening to this week's podcast. Look out for a new episode every Wednesday published on Google Podcast, Spotify and Apple Podcast. If you're interested in hosting your podcast with us, fill the form available in the description below. Thank you once again. See you next time.